From the makers of vet-recommended Greenies dental treats comes an easy way to support your dog's wellness. Greenies Smart Essentials dry food delivers complete balanced nutrition with science-backed recipes. Greenies supplements, developed by a team of PhD animal nutritionists, offers options to help support healthy joints, digestion, and more. Whether it's mealtime or mobility support, Greenies helps you care for your dog from the inside out. Learn more at greenies.com.
You are listening to Veterinary Vertex, a podcast of the AVMA journals. In this episode, we chat about pica as a clinical sign of a chronic enteropathy in dogs and cats with our guest, Julianna Perez.
Welcome, listeners. I'm Editor-in-Chief Lisa Fortier, and I'm joined by Associate Editor Sarah Wright. Today, we have a fabulous former Cornell student, Julianne, joining us. And thanks so much for taking time out of your busy schedule to be with us here today.
Thanks for having me here. I really appreciate it. Just talking about all the research and all the work that's gone into this. I really appreciate it.
Of course. Let's dive right in. So before we started recording, we were chatting earlier how important of a topic as this is. So we're really excited to chat with you more about this today. And your article states how a significant number of animals with pica and foreign bodies demonstrated evidence of a chronic enteropathy. Please share with our listeners the background on this article.
So essentially, background on it was, as the cases we were seeing coming in through the ER, we work really close with an ER in the medicine department over here in Arizona, and started to notice that a lot of these dogs coming in for pica would be repeated episodes of pica, not just one, two, three. There's one that had about 6 different foreign body instances. So we started noticing as we were pulling out the foreign bodies, going through the intestinal tract, it was extremely abnormal. They would have like blunted villi, erosions, ulcerations, all that stuff when we were pulling out from the stomach. So kind of over time started to notice, as we noticed that, started taking biopsies, and the idea kind of came from, well, if these dogs with pica are having these abnormalities further down in the intestinal tract, maybe there could be a cause to the pica. So what we started doing was taking biopsies on every single dog or cat that had pica, and eventually we found that 99% of them had evidence of a chronic enteropathy. Hard to say, is it inflammatory bowel disease? Is it, another type of like malabsorption type of thing? But a lot of them had characteristic findings of lymphoplasmacytic enteritis or eosinophilic, neutrophilic, all of that stuff. And it was interesting that we found that in the intestinal tract, and plus or sometimes in the stomach as well. A lot of the times in the stomach as well, but more so in the intestinal tract. And so there was kind of an argument where, well, if it's in the stomach because of the object rolling around, why is it in the intestinal tract? So then we started to kind of collect these cases, and eventually got to the point where I was able to publish enough of them. There was enough evidence to show that, and eventually we got it after some hard work and cases that came in through the ER.
Yeah, super cool topic, and really glad too that you guys were taking them samples as well while you're in there retrieving the objects. Definitely good to get as much information as you can, right? While you're going ahead
Well, especially because you're already in. I mean, it's a 5-10 minute endoscopy removal. I mean, what's another 5-10 minutes getting samples? And it's, going later on, a lot of the times we find if they're a referral from another clinic or for any reason, and they've had open abdominal surgery or, other foreign bodies, might as well get the information while you're in there. It's just less invasive in the future, less costly to the owner, less surgical procedures in the future of that animal. So we ended up doing it, and it wasn't too bad. That a lot of them did well after the fact and stuff like that. So I'm pretty proud of it. It is a really good topic to do, and hopefully I can expand a little bit more on the topic too.
as you should be.
Yes.
So what are some of the important take-home messages from this article?
Pica is not because animals are misbehaved. I would say in my paper, we kind of classify, and asking behaviorists, the cutoff for behavioral pica was about 2 years of age. I did have a lot of animals that were like 1.5, 2.1 month, or 1.95 months, things like that. And I was able to clarify with a couple of behaviorists that that's kind of the age they find that that pica behavior because of adolescence goes away. And so I would say pica is not because if they're older than 2 years of age, it's not because they're bad animals or because, maybe environmental enrichment, sure, that could be a part of it. But I do think a big part of it is a clinical sign of a chronic enteropathy. And if you address it, a lot of the times it goes away, if not improves quite a bit with therapy. So that's kind of the big home takeaway.
Well, I'll look forward to my daughter's dogs growing out of it. I've lost 4 pair of cheaters in as many weeks, and at the last pair, like, she's very stealth, and I can hear the crunch, and, like, I don't care about them, right? But I do care about the chunk of the lens that she might swallow.
Yeah, oh my gosh. No, my cat, she used to chew on cords and, she grew out of it eventually, but you always get worried. It's like, "Oh, there's a missing cord, my iPhone," or something like that. So I understand completely. But, I think that's the big home takeaway is it's a sign of a clinical enteropathy or a chronic enteropathy would be my biggest thing.
Yeah, it's a Bernedoodle, highly likely.
Those I love doodles. Honestly, that's what I want. I'm looking for a doodle, like a rescue or anything like that. But they were the most common breed, the mixed breeds they call them in our population. So and it's funny because they're so common in Arizona and Scottsdale. So common. Like my physical therapist has one, my friends have them. So yeah, super common. And then I think the second one, pit bulls, Goldens, Labradors, those guys. But it's fine. You deal with it and you get it treated, managed, and they do fine. A lot of their animals did fine. So, but no, they're trouble.
It is such a cool topic for, veterinarians and trainers and, everybody owners, right? What sparked your interest in pursuing this as a research project?
So when I was an intern, I was over at Angel Memorial in Boston, and I had this case. It was a military veteran, and his dog. It was a service dog, and the dog ended up having 3 foreign body obstructions. Ended up getting surgery every single time. I unfortunately got the dog at the fourth time, and they went in, there were so many adhesions and, the guy was not educated on, training and basket muzzles, treatment, therapies, things like that. Um, and the dog ended up getting, an enterotomy, adhesions everywhere, and, unfortunately, the dog ended up dying because they did dehiss because of how bad it was. So, I think that really triggered my, inspiration for this topic and avoiding so many cases coming in for chronic enteropathy, other signs for it. My biggest thing was how could I help all of these animals and how could we avoid death in the future because it's such a common thing and unfortunately I'm not a surgeon, right? I don't cut things. I see things on a referral basis for internal issues. And so what could I do to kind of help this? And that is the biggest case I think will always stay with me and it's just so heartbreaking. You see an adult crying for it was and the dog was 5 years old. So that's the toughest thing, and I think that's really kind of sparked, my interest in GI disease and noticing this is kind of the biggest thing, really just kinda tug at the heartstrings. But that was the biggest inspiration for this, and really just what else could I do to help, without cutting things open because that's not what I do.
Yeah.
So that was kind of the big thing for me.
Sounds like a tough and inspiring case.
It is, yeah. It's sad and just yeah, it's tough, and we see a lot of these and, they'll go to surgery, and a lot of them end up dying because, either because they dehisce, they go septic, or, it's sad, and then they're all young, that's the big
Right.
thing. They're not like they're 10, 12. A lot of them are like 4, 5, 6, 7, and it's like you just wish you could have done more, I think. And that's kind of where I'm at with this topic. So the more awareness, the better in my mind, just to kind of help veterinarians recognize this disease and help animals in the future really is my goal.
Yeah. Sarah asked you a little bit earlier what some of the most salient points of the article, but every time we do a study, we are surprised by things, which then engenders more research. What were some of the surprising findings from this article?
Yeah, I think the most surprising finding was that I think the fact that they all had evidence of lymphoplasmacytic enteritis, even though a lot of the dogs weren't recognized as having clinical signs until really sifting through the records. Like, I'm saying sift, like I went back all the way from when they were puppies up until adulthood, and really like these little nuances, little clinical signs, they would puke a couple times a month, and the owner would say, that's normal for them, or picky appetite. That's a really common one we find, or having GERD signs, things like that. And the signs were not too bad. So eventually we got to the point where when we got that lymphoplasmacytic enteritis, that to me says that this is a severe chronicity, and a lot of them would be severe. So I think that was the most interesting finding that I came out, because I didn't think we were going to find, severe or moderate lymphoplasmacytic enteritis. I thought maybe some mild changes, some, a little bit of fibrosis, nothing. I think that was the biggest interesting finding, and just kind of following the severity of Helicobacter associated with the stomach severity was not an interesting finding, but a lot of people that do gastroenterology research, it kind of fits with that as well. So I thought that was interesting too, given that a lot of the times in those research articles, you'll see, they're vomiting, or they're losing weight, things like that. Not a lot of these animals had the weight loss or the vomiting. It was more so the pica, the picky appetite, the GERD-like signs, things like that. So I thought that was the more interesting ones that I took from the paper when we got all the stats crunched and all the interesting findings from the paper and stuff.
Sounds like a good educational topic for both pet owners and veterinarians alike.
Right. No, that's my goal. So
So with that being said, what are the next steps for research in Pica?
I think so. For me, it's good that, biopsies are great. We got that. I would like to find, because I think there's more so at the molecular level. For me, I would like to see, are there any other micronutrients that they're missing? Are there any iron metabolites in these samples potentially that they could be missing? A lot of the research I found in human medicine were, people that were pregnant, people that are common one that they're anemic, things like that. But a lot of my animals weren't pregnant, anemic. These behavioral issues, they were kind of beyond that. So I'd like to go more into kind of the molecular level nutrients, things like that, to kind of see. I'm looking kind of new job in California. So I'm trying to go and kind of talk to where I'm going to next to see, are there opportunities for me to kind of look more into it, to see, are there any other things that maybe we're just not getting the whole clinical picture because that's not available to us. Maybe there are human hospitals that potentially do this, and maybe I can incorporate that into my next future sample population, things like that. But that's the biggest thing I'm interested in to see, because they may be nauseous, they may not feel good, but it's not as black and white. And I think there's more to it. I think that we're just not seeing. And that's kind of my next goal for my next kind of adventure in research for me.
Very cool. Well, we look forward to hopefully seeing more of your future work too. So AI is a really hot topic. We've seen this a lot, and definitely it's even becoming more popular, I think, too, as a research topic in veterinary medicine and scholarly publishing. Do you see a role for AI in the area of research that you're pursuing?
Well, I think it would be nice if I could get AI, not in terms of doing procedures, anything like that, because then my job's gone, but really for I think for the details, getting details from a lot of the records, getting details from referral vets, things like that, number crunching. I think that would be super helpful. I think that's kind of where the role of AI that I see it in. I'm kind of like, it makes me a little uncomfortable for AI to, maybe diagnose things and interpret things, because I think AI misses that human quality, that we can look at the clinical picture, we can look at the little nuanced things, the trends of things. So I would say keep AI to the number crunching, the detail association. I'm a millennials kid, so I'm very less AI the better, I think, for that regard. But it is neat, right? It is super, it has its place, totally for it. I have colleagues that are younger than myself, and they're doing the records with like ChatGPT and all these things. So more power to them. I'm old school, I use papers all day.
Yeah, one of my vet school classmates actually over the weekend, she posted a really funny video that she had made at her clinic where she was like, I'd like to see AI try to replace like this. And it was her and a technician working to like restrain the fractious cat and then like pill the fractious cat. And they had him like in the quote unquote panini press, you know?
Right.
Yeah,
Oh, that's
exactly.
great.
He makes more efficient, but not replacing us.
Right,
Yep.
right. No, that's great. Yeah. No, there's a
Yeah.
lot of that, and it has its place, I think, one day,
Yes.
but I don't know. I'm still hesitant.
Now, for those of you just joining us, we're discussing pica as a clinical sign of a chronic enteropathy in dogs and cats with our guest, Juliana. And my chronic enteropathy cat decided to join us. You can see her ear here. You're watching the video.
Hey, Julianne, we talked briefly, like Cornell grad, went to Boston Angel. You've got a lot of training and all that adds up. But how getting across the finish line with getting the article all the way to publication is a whole nother beast. How did all that training help you write this article and get it all the way across?
Yeah, gosh, that's a great question. I think the biggest thing is, the perseverance. I got a lot of people that kinda told me, "This is not it's not realistic, it's not an ideal topic, it's not something that may people will argue with you," the experts like Kenny Simpson or, Marks over at Davis, things like that, and, I think it's more so the perseverance, and really, like doing all of these internships, doing all of these the residency, you know what I mean? Things like that. I think really kind of push me to working harder. It helped obviously getting my credentialing in as well because I needed that. But I really think the biggest point was, what could I prove to these big gurus that I can prove and see, hey, like, yeah, I'm a young grad, but I think there's other things we're missing, not just like diet related, not just, you know what I mean? All of these things.
I can't wait to see Simo and say, "Hey, you're a big guru. It's out on Veterinary Vertex."
Right, right. No, yeah, I had him as a teacher too, and man, he's a very big guru in the GI
Yeah.
world.
Yeah.
So yeah, I mean him, Stanley Marks, all those guys, and what could I prove? And that's what I like. I like what could I prove that people don't think is the typical, what is the norm? I like to prove people wrong. And that's just kind of who I am as a person, and that's just kind of what the goal was.
Yeah, we have a lot of these like Mythbuster episodes, I feel like, on the podcast where people are like looking at things that have always traditionally like been thought and they have the evidence to show either otherwise or to validate what we've been doing. So
Right.
yeah, those were our episodes. All right, Juliana. So this next set of questions is going to be really important for our listeners. We're going to take all the great information you've shared with us today, try to boil it down to like one take-home message that people need to know. What is one piece of information the veterinarian should know about pica in dogs and cats?
That at a certain age, it is not a behavioral problem. It's evidence of a chronic enteropathy. I would say that's the biggest take home, and really pay attention to that because um, they do it for a reason. It's not just because would be my biggest take home message.
And on the other side of the relationship, what's one thing that clients should know?
I think clients should be cognizant of really kind of keeping an eye on their pets. The biggest thing being that they can become obstructed, and I think that's kind of the biggest takeaway for owners, and really recognizing that they do it once, maybe behavioral if they're at a certain age, but if they're older and they keep doing it, I would say that's when you should really get it addressed.
That's really nice and concise. Thanks again. Great to see you again.
Yeah, and I see too. Thank you so much for your time. I appreciate it.
Yeah. We always like to end with a kind of a fun question. And for you, we'd like to know, what is your favorite animal fact?
Yes. So my favorite animal fact, a group of flamingos is called a flamboyance. I thought that was the funniest thing ever, and I think that's kind of my fun fact to people.
I love that. The local zoo here, Brookville Zoo, Chicago, they started doing these like flamingo walks, they call them, where they have the
Oh,
flamingos come out in like a kind of like a group and they walk around a portion of the zoo and the visitors get to like see them up close, which is really cool and engaging. But it's the first thing I thought of when you said that fact. I was like,
right.
oh, flamingo walk.
No, I love it. When I was little, they used to have a little petting area, and you could pet the flamingos. They're very aggressive though. So I got bit, so I wouldn't recommend it. So I was like 7, so and then I got bit by an emu like a couple years later. So birds, Yeah, snowbirds.
No thanks.
Yeah. But that's my interesting animal fact.
Very nice. I love that. Yeah, we was at the beach with some friends this weekend, and I have a friend who's terrified of any kind of bird.
Oh, yeah.
And there was like a bird that was encroaching on her because she's, yeah, Lisa's raising her hand. Lisa's like, me too. When she was having a snack and the birds were like walking over. So I was like, all right, here we go. Animal Science 101. I was
Oh
walking
my
over,
gosh.
arms outstretched to make myself bigger to get them to move.
Oh,
So
yeah.
bird herder.
That's great. No, my mom has a cockatoo, and the cockatoo, it's bitten me a few times. So I'm like, no more birds for me. I'm good. I'll stay away. I'm good. Cats and dogs, precious cats. I love them. They're good. But birds, I'm done. I'm done. So
I love that. We need people like you. So,
yeah.
well, thank you so much, Juliana. We appreciate you being here and sharing your insight too about your article with our listeners.
Yeah, thank you guys so much for inviting me. And thank you for showing interest in my paper. It means a lot. Honestly, it does. And it's nice to kind of get this topic kind of out there. Not even the recognition about the paper. It's really for the animals and what we can do different to kind of reduce death, reduce these comorbidities, and treat them. So I think I really appreciate your guys' time.
Of course. And to our listeners, you can read Juliana's article in JAVMA. I'm Sarah Wright with Lisa Fortier. Be on the lookout for next week's episode, and don't forget to leave us a rating and review on Apple Podcasts or whatever platform you listen to.